Hello, my name is Dave Rakel. I'm the director of the Integrative Medicine Program, and this is the module on low back pain. And we're talking now about the structural or the external piece. And the evidence-based guidelines suggest for low back pain that OMT, osteopathic manual therapy, chiropractic, massage, acupuncture, and non-steroidal anti-inflammatory drugs have the best evidence for benefit. So we're going to review those with Amy Bauman. Amy is an osteopathic physician, one of our third-year residents who has good hands, as they say in the OMT world. So Amy, thanks for also helping us co-write this module.
Yes.
And so can you first of all tell us a little bit about OMT, the manual therapies? One of the questions I often get is what's the difference between a direct and an indirect technique?
Right, yes. So direct techniques are techniques that bring the joint motion towards the physiologic barrier. And then the practitioner is working to move towards or even sometimes beyond that barrier. Whereas indirect techniques are various different types of techniques that work within the physiologic barrier.
So use me to define the physiologic barrier.
So if we were to use your head, for example, I'm going to turn you this way towards your barrier, sort of where you stop turning. A direct technique is going to go in that direction.
Beyond that barrier.
Beyond that barrier. So an HVLA technique, which is the one we often hear about, the cracking and popping.
Stands for?
High velocity, low amplitude.
Okay, so.
Yeah, exactly. So this is the technique where you would bring the head towards that barrier and you would actually push, the HVLA technique would push beyond that barrier. Okay. The muscle energy, which is another type of direct technique, would again bring you towards this barrier. And in this technique, then I'm going to have you push against my hand here. So you're going to go away from the barrier and then relax. And then I'm going to push you and stretch you towards that barrier. And you repeat that.
That's a little bit more gentle than the...
Yes, it is.
But it still goes beyond the physiologic barrier.
Right.
So thus a direct technique.
Right. And it's nice because it's something that practitioners can do with patients, but patients can also sometimes do on their own as well.
So tell me some examples of indirect techniques.
So indirect techniques, we talk about myofascial release, which is where you're working more with some of the fascia and superficial structures. And as with all indirect techniques, you kind of bring the tissue to the point of ease, is the verbiage we use, but sort of the way the tissue likes to go.
Okay.
You find that point, you hold it there, and you let it release and go back into a more neutral direction. And you, as the practitioner, are sort of monitoring as the tissue does that.
So you get biofeedback from your hands.
Right.
And when that releases or you feel that tension release, you enhance the mobility?
Exactly.
Okay.
Yep.
Okay.
Yep.
So strain counter strain is one of my favorites because it's easily to conceptualize.
Right.
It's after you get used to some body parts, it's easy to remember, but it takes a lot of repetition to remember where those positions are. Can you define strain counter strain?
So strain counter strain is a technique that again, it's indirect, so you're bringing the tissue into a point of ease. You're finding a tender point in the body, which is usually at the proximal or distal end of a muscle. And then you're going to shorten the muscle belly.
So let's say I have medial epicondylitis and I have a trigger point
we've
there.
got a trigger point here. Yeah. We're going to kind of wrap around that. So we're shortening the muscle belly, wrapping around the point, and then you hold this. And with some techniques, you'll actually have the patient use respiration to enhance it. And you wait for a release. And you can often feel that underneath your finger.
Yeah.
And then afterwards, you kind of release the muscle, and usually people will notice they feel better.
I love it when you feel the muscle go to mush.
Right.
Levator Scap is my favorite one because we all have that trigger point.
Yes, everyone has that one.
And so you would, for Levator Scap right here, right?
Right.
You would shorten
You would shorten it. So oftentimes you end up bringing the arm up and over. And you can kind of adjust, not everyone's going to be exactly the same, and you're kind of asking them. One thing you can do is say, we're starting out at 10 out of 10 pain, and then we're going to try to find a position that's 0 out of 10 or as close to 0 as we can get. Then you use feedback from the patient to help guide which position is the best position to hold.
And it goes from like 80 to 10, and then you ask them, does that still hurt? And they say, well, you're not pushing as hard,
right.
but you are.
But you are, yeah. Right.
It's a great technique because we used to do a lot of xylocaine injections for trigger points, but this works much better,
Right.
and you don't have to stick them with a needle.
Right.
Although, sticking people with needles also seems to be beneficial in the form of acupuncture.
Right.
So this was also included in the NICE guidelines, and epidural steroids was not, which I found very, very interesting. But another thing about acupuncture, which appears to get the energy to flow beyond a place of constriction, is that in some of the best studies, the sham worked just as good as the actual acupuncture,
right.
which tells us the importance of this therapeutic practitioner effect,
right.
and really organizing that process through someone who cares.
Right.
It's a mysterious process.
It is. It's very fascinating.
How about massage?
Yeah, massage is another great technique. Patients love it.
Yes.
So I think referring them for massage is going to make them very happy. And a lot of massage therapists out there will use some of the techniques that other manual therapists use as well. But it's great because it helps people feel better, and it's also very effective.
Yeah, and it honors the evidence for the benefit of the therapeutic touch.
Right.
It milks the lactic acid out of those trigger points,
right.
enhances lymph and blood flow, and most people feel much better when they get off the massage table.
Yes.
But the question always is, why doesn't it stick?
Right.
Why does the pain come back?
Right.
And this is what we're going to explore in our next little clip about the emotional piece, the most neglected piece of low back pain.
Right.
That's why I think we're stressing the importance of this three-legged stool in treating low back pain, is because if we rely too much on one of these legs, we're going to topple over.
Right.
And the pain is going to reoccur.
Right. If we can find a way to make it stick and help patients, retain the benefits, then we're doing a good job.
Yeah, long term.
Long term.
Good. Thank you, Amy.
Yes.